Welcome back to the County Commissioner's Corner for November. Again, I'm Scott, this is Tamara and Josh. Thank you for joining us and sticking around if you made it through the first segment. We are now going to talk about COVID-19. It is November of 2021. This is about 18 months in, which is much longer than I think any of us ever thought. And certainly we would love to be out of this situation, but we continue to find ourselves in a sort of high transmission activity zone within Summit County and within the state of Colorado. And so I'll just turn it over. Josh, maybe you want to start to just talk a little bit about what's going on, and then maybe some of the steps that folks can take to try to help continue to pull us out of this mess.
Absolutely. So as you said it really well. We didn't think we would still be sort of addressing COVID-19, especially after the year that we had in 2020. But as we're sitting here in November of 2021 looking at sort of what's going on in Colorado and in Summit County, we know that we continue to see pretty high rates here in Summit County and in Colorado. We're continuing to see hospitalizations. We're continuing to see how the influx of folks coming in from out of state is affecting our community. And as we look again to the fall season and the resort season, we have to be thinking about what can we do to proactively support our workforce and to protect our families. The big news this month in November is that one of the remaining vulnerable populations, which is kiddos ages 5 to 11, were approved at the beginning of this month by CDC to receive COVID-19 vaccination, the Pfizer. So that's really exciting news for the households that have really been working to protect the youngsters. This past summer, we saw an increase across the United States, across Colorado, of pediatric cases of COVID-19. One of the largest increases among the age sectors was with this younger population. And although we know that the likelihood of severe illness, hospitalization, and even death among this particular population is lower compared to others, we did see a huge spike in that. And we also know that no matter your age, you can continue to spread COVID-19. So it's important to think about those 5 to 11-year-olds and sort of what they're doing, how they interact with their family, how they're involved in activities, if they have older siblings, if they have younger siblings. And especially as we're going into the fall season, if you're thinking about visiting multi-generational, family gatherings, et cetera, thinking about having those kids vaccinated. So it is a dose that is a Pfizer dose. It's a third of the adult dosage, so it is minimized, really to try to reduce the potential side effects for kids. And it's going to be 2 doses that are 3 weeks apart. So timing is perfect as we're into November. If you're thinking about traveling over the holidays or having folks, come into Summit County, or we know how we have such an influx, it's high season here in Summit over the holiday season. Timing is great. So you can get your kiddo a vaccination, get their second dose, and then by December or so, mid-December, they'll be fully vaccinated.
Yep. And the county's website is a great resource for information around vaccine clinics, availability of vaccine. Again, there are clinics that are being done by our public health. There are clinics that are being done in coordination with the Summit Community Care Clinic. There are vaccine buses, mobile clinics that are coming from the state. Pharmacies have the ability to do vaccinations as well. And so take a look at that site. It will have all kinds of information and resources for folks where to go to seek out vaccinations. The other big news is around boosters. And because of the level of transmission, the level of activity within Colorado and within Summit County, essentially the entire state is identified as high risk. And so anybody that is interested in receiving a booster dose that is at least 6 months after their first or their second dose of the original vaccine is eligible then to get a booster dose. And so Tamara, you want to talk a little bit about that?
Yeah, I got my booster dose on Friday. Very exciting. And my kids are all getting vaccinated today, or their first vaccines today. So I would really encourage everyone to contemplate getting a booster booster dose at this point, especially if your second vaccine was more than 6 months ago. We are definitely seeing a lot of breakthrough cases in Summit County, and unfortunately, or fortunately, because of the vaccine, those breakthrough cases are, really don't exhibit any symptoms largely. And so that means that you could be fully vaccinated, but could still have the virus and could be exposing others around you to it without even knowing it, with the best of possible intentions. So definitely contemplate getting that booster. As Scott said on our website, we have lots of different clinics to make it really easy for folks to access those. And any of those clinics that are on our website as of today, which is Monday the 8th, will also have the child vaccine. And so it is really easy for you to go get your booster and for your kids to get your vaccine. In Summit County, we've sort of said since March that the only thing that would put us back in the place of COVID restrictions was seeing an increased impact on our local hospital. We have been incredibly fortunate that we have not yet seen that in Summit County. Unfortunately, on the Front Range in Denver, they have seen that. And so we really need everyone to help us avoid any kind of further restrictions, to get your booster, to get your kiddos vaccinated, to wear your mask, and stay home and get tested when you have any symptoms that might just be a cold but might also be COVID. Because of the prevalence of the vaccine in Summit County, it's often difficult for us to tell the difference. And if everyone can just hang in there a little bit longer and do their part, we can avoid a return to some of the things that we saw last winter, which our economy and our community desperately need.
And in terms of the hospital component, our hospital system is reliant on the Front Range. And so it is important to understand that in many cases, patients that are, for whatever reason, originally located here at Summit Medical Center do end up getting transferred to other facilities. And so where we could potentially see challenges and see our hospital capacity numbers increase is if facilities in the Front Range aren't able to accept transfer patients. And so there is this very sort of direct relationship between what's happening on the Front Range and what could happen within Summit County and Summit Medical Center. And so it is critically important for folks to take this very seriously. Again, wear masks, as Tamara said, when you're indoors. Try to be sure that if you're exhibiting any symptoms or you believe you've been in close contact with folks, that you're going out and you're getting tested at the facilities that are available. The local providers are doing testing as well for their patient populations, and so take advantage of those resources now being available. We all remember how in short supply testing was. We all remember when vaccines were in such short supply. We no longer have those kinds of supply chain issues around testing and vaccination. So take advantage of the fact that they exist now amongst a wide variety of locations within Summit County. And if you are sick, stay home. And one last plug that Amy would be upset if I didn't mention, and get your flu shot.
Yes.
It's important to get the flu shot because we don't want flu folks or folks with the flu to begin to occupy those beds within hospitals locally or on the Front Range as well. And so anything we can do to prevent a significant flu outbreak will be beneficial in the grand scheme of things. So,
if I can add to, we know that this has been such a community effort. Summit County has done a great job in terms of participation in these programs, getting vaccinated. A lot of the businesses have provided, either formal or informal incentive programs, really to, gear up our workforce and get folks prepared. So, kudos Summit County. And there's still a lot of misinformation out there about boosters. As well as the vaccines for kiddos, 5 to 11. I've seen and had questions from parents, sort of, what's the efficacy? It's one thing for me, it's another thing for my first grader. And we can just say, go to our website, we have lots of great information there, or talk to your trusted healthcare provider, talk to your pediatrician. Go directly to the person who will be giving you the shot and ask those questions because they can help you make the best decision for your family and for your kids.
Yep, great point, great point. All right, that's all we've got for today. Thanks very much for joining us, and we'll be back probably in a month.